A person with jaundice may notice a yellowish tinge to their skin, mucous membranes, and the whites of the eyes. It can happen with various health conditions and usually indicates a problem with the liver or bile ducts. When the liver is not working properly, it can cause a waste material called bilirubin to build up in the blood. With moderate bilirubin levels, a person's skin, eyes, and mucous membranes can turn yellow. As it progresses, the color can also change from yellow to green. The green color occurs from biliverdin, the green pigment present in bile. Jaundice can develop in people of all ages and is normally the result of an underlying condition. Newborns and older adults have developing jaundice. In this video, we have discussed what causes jaundice, how can diagnose and treat the condition, and how a person can help to prevent it from occurring. It also explores the symptoms a person can expect. Causes and risk factors. Jaundice is the yellowing of the skin, mucous membranes, and the whites of the eyes that occurs when the body does not process bilirubin as it should. Bilirubin levels increase as the red blood cells naturally break down. Typically, the liver filters this waste material out of the bloodstream and turns it into a new form called conjugated bilirubin. The new form then exits the body in a person's stool. If there is too much bilirubin for the liver to process, it can build up in the body. This is known as hyperbilirubinemia, and it causes a yellow color in the skin and eyes. Jaundice typically occurs due to an underlying disorder that either causes the production of too much bilirubin or prevents the liver from eliminating it. Some possible underlying conditions and causes of jaundice: gallstone disease or excessive alcohol consumption, gallbladder or pancreatic cancer, cirrhosis, which is a disease that causes scar tissue to replace healthy tissue in the liver, hepatitis or other liver infections. Treatment will depend on the underlying cause of jaundice. Jaundice can lead to itching or notes that a person can have warm baths containing oatmeal and take it for mild pruritus. A healthcare professional may prescribe medications for those experiencing moderate to severe pruritus, such as cholestyramine or cholestyramine. As jaundice may sometimes indicate damage to the liver, a liver transplant may be necessary in some cases, depending on the severity of the injury. Common symptoms of jaundice: yellow tinge to the skin, mucous membranes, and the whites of the eyes, pale stools, and dark urine. Itchiness in infants. The yellowish tinge can start at the head and spread down the body to the toes. The United Kingdom's National Health Service, NHS, notes that jaundice may be less apparent on black and brown skin. It is more obvious in the whites of the eyes. Accompanying symptoms of jaundice may include fatigue, abdominal pain, weight loss, vomiting, fever. Complications: high levels. Trusted sources of bilirubin can be toxic and lead to a rare type of brain damage called kernicterus in infants. The underlying conditions causing jaundice can also lead to their complications. Types of jaundice: 3 trusted sources. Main types of jaundice include prehepatic. This occurs before the liver processes the waste and results in higher unconjugated bilirubin levels. Hepatic. This occurs in the liver and results in both higher conjugated and unconjugated bilirubin levels. Posthepatic. This occurs after the liver has processed the waste and results in higher conjugated bilirubin levels. Bilirubin levels: normal bilirubin levels are less than 1 mg per deciliter, mg/dl. A person has jaundice if these levels reach approximately 3 mg/dl. A 2021 article trusted thesis source notes that doctors may diagnose jaundice in infants if the bilirubin levels increase to 5 mg/dl per day or more than 0.2 mg/dl per hour. These ranges may differ between laboratories. How far above the normal range a person's levels will help a doctor determine the best course of treatment. Diagnosis: doctors will most likely start with the person's history and a physical exam to diagnose jaundice. They may later also order lab tests. During an examination, they will pay close attention to the abdomen, liver, and skin. The doctor may often include lab tests to help determine the underlying cause of jaundice. These include bilirubin tests. A high level of unconjugated bilirubin compared to levels of conjugated bilirubin suggests hemolytic jaundice. Full blood count, FBC, or complete blood count, CBC. This measures levels of red blood cells, white blood cells, and platelets.
Hepatitis A, B, and C tests. These tests are for a range of liver infections.
The doctor will also examine the structure of the liver if they suspect an obstruction. In these cases, they will use imaging tests, including MRI, CT, and ultrasound scans. In addition, they may carry out an endoscopic retrograde cholangiopancreatography, ERCP. This is a procedure combining endoscopy and X-ray imaging. The OPF states that a healthcare professional may perform a liver biopsy. A liver biopsy can check for inflammation, cirrhosis, cancer, and fatty liver. This test involves inserting a needle into the liver to obtain a tissue sample. A healthcare professional will then examine the sample under a microscope. Thanks for watching.